How, when do I come in a little bit better now? Is Josh Keener on the call? Okay, Vince, if not, let's go ahead with you and Sammy, please.
Well, I hope you can hear me okay.
Loud and clear.
Okay, well, there's two sets of slides that you have. Sammy has some numbers from case numbers. I'll have her go over those first. And then the second set of slides, I know there's a time crunch here, so I do have a little bit of financial performance information that I want to share with you. So I'm going to ask Sammy to go over the case numbers, and I'll finish up by going over some economic impact.
Okay. Sammy, you're on.
Good afternoon, everybody. I'm sure you all have seen the latest numbers. Looks like there's a little over 35,000 cases in the state of Arkansas. Those numbers are continuing to rise. If you look at Boone County, it looks like we've got a total positive of 81. We've got active reported as 35, recovered as 45, and 1 death. We're continuing to see increase in positives. Our positivity rate for our clinic is running a little over 10%, and that is excluding all of the patients that we're doing for preoperative testing, which we would consider to be asymptomatic. So lots of activity still going on. You can see that across the state, we're looking at increased hospitalization, increased ventilator usage. We do have some incidents of nursing home residents, which we recognize as our most vulnerable population. Next slide, please. So I took this slide today from the governor's press release. Some of you may have seen that. If you take a look at where Boone County is, you can see that our percent of increase is winning the race, and I don't think that's a race we want to win right now, but it is a message out to how cognizant we need to be about the requirements that are out there. The governor has issued a statewide mandate for masks. We need to be encouraging everyone everywhere that we can. And I will tell you that one thing we have seen in spades is that we are having a lot of difficulty in smaller businesses and smaller practices, smaller organizations with employees. And we don't see our coworkers as a risk. But the reality is that everywhere that coworker is, and then they come back to us and we engage them without a mask, we're in the same break room with them. We eat lunch with them closer than 6 feet. We're in confined spaces. We're putting ourselves at risk. And the unfortunate part is then that is a huge impact from an economic standpoint to that employer and how it impacts the businesses. So I challenge you guys to really spread the word, encourage your staff, separate your break room, separate your congregating areas. We've seen a lot of situations where we've had half of businesses with people off because, they had a potluck. So I know we all still need to interact and we're social by nature, but now is the time as we see these numbers start to rise in Boone County, we really need to be careful and try to do everything we can to flatten this curve. Next slide, please. This just shows kind of, if you take a look, we are the Northwest region. You can kind of see that we have had a decrease in some hospitalizations in our region, but you can see that the metro area is growing. We learned yesterday that the governor has approved for the National Guard to the Washington Regional. They're going to be coming in to do some clinical type clerical functions, case management type roles. And the goal there is they're going to shift their case managers into ICU to try to give some of their staff some relief. They're having difficulty with sickness in the workforce as well as increased patient loads. So just trying to take steps and recognizing that our region is impacted. We're working closely with the State Hospital Association, State Health Department, looking at bed availability, making sure that we have ICU beds open in our region and in our area, and monitoring that much closer than we ever have. And so that gives us a good indicator that the state is concerned as a whole, not just necessarily about this region, but about the growth within the state. Next slide, please. Can you hear me? Next slide, please. Oh, there we go. Okay. So this is just kind of a reminder, if you guys haven't seen this, the face covering directive from the governor. Again, I encourage you, please share this at every venue that you have. I know that many people have voiced frustrations and concerns with putting the mask on. Please help them understand that they are not necessarily protecting themselves, but they may be protecting someone else's grandmother or cousin or someone they know with lymphoma or whatever the case may be. But putting these masks on is one way that we know we can decrease the spread of this virus. And it's a fact. It's here. People are going to get sick. We're going to have taxed resources, but we need to manage through this, and we need to do everything we can to mitigate it, to try to promote the health in our community, keep everybody healthy, and keep growing from an economic perspective, because we all recognize what the impact is here. Next slide, please. The next slide should be from the CDC. So the Center for Disease Centers has released some updated changes as far as what they're considering recovered. The Arkansas Department of Health has not changed their guidelines yet. Their guidelines are effective June 18th. But what you can see is this is just a brief snippet of the changes, but they decreased the criteria from being fever-free from 72 hours to at least 24 hours. And they changed improvement in respiratory symptoms to improvement of symptoms overall. And the reason for that is because we're seeing patients with a wide list of symptoms related to COVID-19. And those are the primary considerations, I think, that are important to understand, that are out there as we start talking about how we return these people into the workforce and keep others safe. Next slide, please. The CDC has made several recommendations for how to manage this. If you have difficulties or if you have questions, you're welcome to give me a call. You're welcome to call the COVID hotline. We'll be happy to direct on this. I know that there's a lot of consternation and question about when is it safe to bring someone back? How do I manage when they re-enter into the workforce? And then what do we need to do to protect everyone else in the workforce? So I just wanted to bring that up, let you know those resources are out there. And if you have additional questions, let me know, and I'll be happy to do what I can to answer those or direct you to the information. And that concludes my report, unless there's a specific question. And I think Vince has got a little bit of information.
Cindy, let me just tack on to your comments, and let me go back a slide to the governor's, or to the Department of Health order and the governor's executive order. Part of that executive order requires a notice to be put on the front door of every single building and business in the state of Arkansas. It is not an option. It is a requirement by his EO. Those posters in both English and Spanish are available on the Chamber's website and at our social media links. And I would encourage everybody that's on this call to ensure that you have those available, and tell your friends and tell your other business compatriots. They need to get those. I was in 3 businesses in the last 2 days. Nobody had them up. A national chain and then a local business. They did not have them up. So please, Wilson has just shared with you the link. Please make sure that those are up in all businesses. And I apologize if there are questions for Sammy to go over. And let me say, Vince, at Sammy and I talked, and because of timing, I did not put your other deck up.
That's fine. That's fine, Bob. I've just got a few numbers to go over with you.
Okay, good.
I don't know if you're familiar with a company called Kaufman Hall, but they are an international consulting firm that does financial analysis of hospital systems. and they came out with some numbers yesterday that are very interesting. Beginning, the numbers that they have provided me show that most hospitals are running a margin of about 3.5%. So that tells you how thin the margins are for hospitals across the country. They've done a couple of projections based on recovery from the COVID-19 epidemic. They put together two scenarios, an optimistic one in which there is a gradual return to normal with cases dropping over a period of time and patients coming back to the hospitals for their elective procedures. They've given that about a 4 in 10 chance. Their less optimistic projection is about a 6 in 10 chance, and that assumes patients demand will be affected by incremental surges. There will be government interventions, public health interventions that may stop us from doing elective procedures, which I understand that Arkansas is already talking about. As a 6 in 10 chance that scenario may occur. Now, as you are fully aware, the federal government has provided a fair amount of relief for hospitals. But what we're seeing now is that with the relief, the average margin for a hospital will drop to about -3%. And the calculations right now are based on figures that say, without the CARES Act funding, hospitals across the country would be at about a 15% negative margin. And they're saying, without further intervention from this federal government, that margins in hospitals will sink to about -7% and stay that way throughout 2020. A couple of issues here. One, we don't know a lot about this disease yet. We don't know how it's going to affect our businesses. Hospitals need to be available to care for folks. We're spending money like drunk sailors up here to make sure that we have enough PPE and equipment to take care of folks that are coming to our door. But without some intervention, further intervention, hospitals are going to be in a jam. The predictions right now are hospitals will range from a -1% to a -11% margin across the country. They're predicting that 51% of the hospitals by the end of this year will be in excess of 15% negative margins. A little bit of disturbing numbers. And what's happened here is that the business that the things that we do that drive revenue are elective procedures, elective lab, elective imaging, elective surgery. And the COVID pandemic has caused patients to postpone those things, to delay, sometimes creating a worse situation for patients. But in order for a rural community hospital to survive, the community needs to use it. In order for this hospital to survive, we've got to be able to manage our costs effectively. But these predictions from this national consulting firm, predictions from national consulting firms are a little bit like the weather report in Arkansas. They can change. But all of these numbers I've just given you don't sound really good for anybody. So if we are whining about no margin, you'll understand that there are several thousand other hospitals in the country doing the same thing. So our picture is not going to improve for a long time until either there's a vaccine or either there's a vaccine and people come back to the hospital for their care, or people come back to their hospital for their care. So a little bit of dismal news for us all today. So thank you, Bob, for letting me present that data.
Okay, Vince, it is sobering to say the least, and I'm convinced just in reading the news from around our region that our other medical centers, Fayetteville, Springfield, Mount Home, are all going to be in the same situation. It's not going to be different. So I personally appreciate you keeping us abreast of these important notes. I don't believe that Dr. Josh Keener is on, so I want to jump on to Representative Ron McNair, who has jumped on the call. Representative McNair.
Yes, sir.
Hey, what's going on in Little Rock?
Just discussing money and contact tracing and mask wearing and different things. Of course, I just got on here, so I don't know what's been talked about. But you got any particular questions for me?
No, I think it was just we had a report from Vince Lease and Sammy Cribbs at the hospital reviewing the data in the northwest part of the state in which we are considered is not doing good. And Vince had just given us some data that the forecast for regional hospitals like Northwest Arkansas are not looking good from a revenue standpoint the year going. I think one question that we've had circulated here at the chamber in the last couple of days is any feedback at your level, at the state level. I know Scott Filippo has just joined as well. Any feedback on the governor's mask order? Is there any negative feedback from an economic standpoint that you have heard about?
I've had quite a bit of negative comments about it. Of course, it's not so much about the mask use as it is the mandate to do it. It's kind of mixed on the responses that I've got. Of course, I'm sure Senator Filippo is probably the same, but my phone started ringing about an hour after it was announced, and so there's and I hadn't been in any conversation this week since I've been down here because I hadn't had time. In fact, I didn't listen to the governor's comments today. I'll have to go back and listen to it later. But like I said, as far as constituents, I've been contacted by several, and of course some of them didn't want to wear a mask to start with, but then the mandate really irritated them. But we've got to look at our numbers too, and they're not looking very good.
I think, and I appreciate that those comments. I think Sammy Cribbs gave us a good 2 or 3 good pointers on why it's important, whether we like it or not. This is not about us; it's about others. So,
right.
Scott, you're on.
Yeah, thank you, Bob. And just and my earbuds are not working for some reason, so I hope that everybody can hear me. To briefly follow up with what Ron just said, that naturally I've heard from what feels like the majority of my constituents, although I know it's not, but the vast majority have been opposed. However, not to politicize this, but I'm getting ready to. And so I'll say, as a conservative and as a Republican, I believe that I got a decision to, that I have the ability to make decisions for myself. What I don't have the right to do is to dictate, the decisions for somebody else, in this case, a business owner or any private industry. So if you go into a restaurant or a retail store or anywhere else, and they ask you to wear a mask, I'm telling people that I visit with that, some of the most adamant anti-maskers, that either put a mask on or leave, because you don't get to dictate to somebody else how they're going to run their business. And, this is something where I actually believe that, proper mask usage can help mitigate the spread of COVID-19 when social distancing isn't possible. I don't know that I don't necessarily agree that it needs to be criminalized. But from a business standpoint, because I've had a lot of small business owners that have reached out to me over the months, and a lot of them just didn't want to be in the position to have to get in the middle of whether or not to require their customers to wear a mask or not wear a mask. They got 50% that want to wear a mask and 50% that don't, and they don't want to be in the middle of it. And, what I tell them is that you've got a right to run your business. You've got to look out for your employees, for your customers, and you don't have to explain that to others. And I think that certainly as Republicans, that should be something that we're always advocating for. The governor, I'm meeting with him tomorrow morning. He's not given any definitive end date to this. What he did release in his initial mandate or statement was if a county goes 28 days without any new positive cases, they can do away with that ordinance. I know most of the law enforcement entities in North Central Arkansas have released statements that they're not going to be just stopping people and writing them citations for not wearing a mask, but they will be responding, to calls from businesses where they do have a problem with somebody refusing to wear one. And to that, I say, great, throw the book at them, because they don't have that right to sit there to dictate to somebody else, how they're going to run their business. The important thing here too is that we want to keep our businesses open. We want to get our schools back open. And so we've been very fortunate in North Central Arkansas. I think in Boone County, we're right about 19 cases, probably about the same over in Baxter, maybe a few more in Boone, but overall very nominal. It's like 0.15% of the overall population in Boone County has tested positive. So in comparison to a lot of counties in the state, we're doing great. But naturally, folks in our neck of the woods don't like to be told what they have to do or what they have to wear. I completely understand that. And so what I just ask for people is be a good neighbor and a good citizen and don't be a jerk. It's pretty simple.
Thanks, sir. Thank you. It's a good perspective.
And if anybody's got any problems or anything specifically, please reach out to myself or Representative McNair. You can, Bob's got my cell phone number. Give me a call or shoot me a text if there's something specifically or an issue that you are having. Want to make sure that there are proper, channels of communication between your legislative delegation and our folks back home. So as it pertains with the, Department of Health or the governor's office or anything else that you need clarity on, please reach out to us.
Scott, I appreciate that. I think that's very good. We have one question Jerry Jackson would like to ask.
Yeah, Bob, I want to add something to the mask issue. Over here in Boone County, last week, it was just like, for me anyway, it was just like Ron and Scott described, phone ringing off the wall, people going crazy, especially after the governor announced. But I will say, and I think later on, Chris and Tim, Chief Grady and Sheriff Robertson are going to share a little bit about what they did, but they put together a statement to the community that has absolutely calmed Harrison and Boone County.
Yep.
We went from phone ringing constantly to nothing, and they did a terrific job. And so around here right now, I think everything's positive. So when Ron McNair comes back, I think you'll find it's pretty good back here. So I think we've got a positive wave right now. Walmart's 99.9% wearing them. So is everybody around town right now. So I think we've turned the corner, and hopefully it'll be positive going forward.
Well, Mr. Mayor, I can assure you that Representative McNair and myself are not going to be doing anything to beat the war drums or rile people up. So when we come back home, we're hoping for a calm and peaceful environment ourselves. And so we have good people. People are generally respectful of their neighbors and each other. And that's one of the great things of why we choose to live in North Central Arkansas, because of the people. And so I thought that Chief Grady and others have done a great job with the response to it. It's quelled a lot of it. And so I think as we move forward, I'm not anticipating there to be any, great, backlash. But now, naturally, people want to know, from what I'm hearing now, is when's it going to end? Well, there is no definitive end date at this time, but I will certainly let you all know, as well as Mr. Largent, and I know Ron will do the same as soon as we know that.
Hey, and thanks, Jerry. I think you make a very good point, supplemented by Scott's comments there. We've got an outstanding sheriff in Harrison that I think their proactive stance on getting the word out did in fact make a difference. So all that's good. Let me jump to Main Street businesses. And while Joan Bell is out of town, we've got Emily Powers, the owner of Frenzies on the Square, on the call. Emily, kind of give us your perspective of the small business perspective of what the mask order is doing and any challenges you face.
So far we have not had any customers come in that have been like refused to wear a mask or anything like that. If like right now, we're not having any trouble social distancing. So as we prepare for tax-free weekend and those kinds of events where there will be more people in the store at one time, that may be a little more challenging. But right now, not really having trouble on the customer end of things. I spoke with Joan earlier, and her and I both have had the issue of employees refusing to wear masks. Rather if they say it's for medical reason or just they don't want to wear one. So we're just trying to figure out the best way to kind of handle that and encourage them to wear one without just sending them home. So I think that's our biggest struggle at this point.
I think, thanks, Emily. You probably bring up something that a lot of folks on this call are dealing with, and that is, in fact, employees vice customers. It's your choice as a business owner, as the manager, the supervisor, to direct employees to do as you say. That's not meant in a negative way. They have to follow your direction, or you can send them on. They push back and become belligerent and so forth. You can, in fact, suspend them and terminate them. Those are things that you don't want to do lightly, especially when you're employees. So we hope that we know that you've got great persuasive skills. So I think it's talking about the positive things that Sammy mentioned earlier that will keep your employees in tune. So thank you. Any questions for Emily or small business community? Okay, Jimmy Lewitt, you're up next. Jimmy, are you on? I thought I saw your name. Sorry. You are on. Okay. Again, I want to emphasize, let me ask, I see Clint Broom, you're on from Strand. From the prime business manufacturing standpoint, do you have any comments for us with regard to the mask order? Are your employees complying with that order?
No, we've had a pretty good response to it actually with the employees, and they've been pretty diligent all along with wearing masks. And our business kind of dictates they wear a mask most of the time anyway because of the dust. So it hasn't really been a big impact to them at all.
Good. That's good to hear. And the manufacturing is key to Harrison. And on Industrial Park Road, we've got roughly 2,000 employees out there. So we hope that we maintain the stability that we've got. So appreciate those comments. Any questions for Clint and the industry folks? Okay. Dr. Esters asked me to put these two slides up. One is the Healthy Campus Plan that he talked about 2 weeks ago. This has not changed. This plan is being implemented by the North Arkansas College staff and just some upcoming events. Nothing has changed. In fact, several organizations have met at the JPH Center. They've got a nice socially distanced venue set up, and it's very helpful. All right, Dr. Pratt.
Good afternoon. Thanks for visiting with me today and listening for just a second. I've got a few slides for everybody, but since our last meeting, a couple things have changed. The governor came on Thursday and pushed the start date of school back to the week of the 24th. You could start the 24th, but no later than the 26th. And we just believe that our little ones, our preschool, kindergartners, and first graders really struggle with 5 consecutive days of all-day school. Many of them fall asleep. They just struggle with that long day on the very first week. So we're going to start on Wednesday, August 26th. Will be our first day of school, and we're looking forward to it. to it and can't wait to have all of our students back. It's been a long road away from them. A couple things I'd just like to go over real quick. The state health departments put out a point of contact. It's a process that we'll use to work with the health department. We have each school district has a point of contact that will report with Boone County Health in this case and let us know that whenever a parent calls in and says their physician or they've been notified that they are infected with the COVID-19, they will communicate with us, and then we'll work with Boone County Health to talk about contact tracing. And I'm on a bird walk for just a second. So when we think about our kids, we're working really hard to use a cohort type system to minimize infection in school. While we will be wearing masks in grades 5 through 12 at this point, and there's an asterisk there and I'll come back to it, we will be wearing masks and trying to do all of our hand washing and sanitizing. We still need to keep kids in quadrants or in cohorts that minimize anytime there might be an infection. So give you an example, when we go out on the playground, we'll have them in quadrants so that if there is an infection and there's someone that's been in proximity less than 6 feet for more than 15 cumulative minutes, then that small section would have to go home, but not everybody in the grade level or that classroom. So we're working on that premise, which is the guidelines that come from the state health department and our commissioner, Johnny Key, to try to place kids in scenarios where there's very small cohorts, if not independent of 6 foot distancing from each other, so that if you get a call that there's been somebody next to your child, then there'll be very few kids going home. So you might see partial amounts of classes going home when the infection occurs. I'm going to use when because I'm following Vince and Sammy. It's not a matter of if, it's a matter of when. But when there's some infections in our school district of 2,750 kids, we're going to have some, but it'll be try to minimize that to the smallest amounts so that school can continue and safely keep learning moving forward. Also, I want to talk about the mask just for a second. I know we have mixed beliefs about the masks, and many people's talked about it. At this point, the governor's indicated from age 10 and above. Remember that school doesn't work on age, it works on grades. So in the 4th grade, we have 9-year-olds that turn 10-year-old. So we're having a conversation about what to do to qualify that for the governor and how that will work. It seems simple, but it's not so simple. Just trust me. But right now, definitely grades 5 through 12 will be wearing masks. And of course, added to that we're working very hard for social distancing and using routines and practices to keep kids safe. The one place we can't really control distancing very as well as we'd like is on the bus. We won't be packing people in 3 of a seat, but we can't have 1 in every 4 seats either. So there'll be everybody on the bus will be wearing masks if they ride the bus, and we're going to distance them out in the seats the best we can. But that's our mode of transportation for many kids to get to school altogether. And the other thing I want to say on this slide too, that's really important. Please know that those of you that have kids in schools and those that are around you, if you want to communicate, is that the routine will be assigned seating everywhere you go. So again, back to that contact tracing piece, if we set at the same lunch area every day, we know who the students are that are in close proximity if there is a contact tracing necessary. So we'll have a lot of assigned seating and a lot of assigned placing of students throughout the year. And we'll try to rotate that up, but again, it's for safety purposes. May I have the next slide, Wilson? The other thing too is some other pieces that we wanted to share with you before I go out to the public with them is that, breakfast, again, those areas where we really congregate, we have to be careful with. So breakfast will be more of a grab and go. You grab the breakfast and then students will go directly to their classroom, again, to minimize the number of cohorts that are grouped together. We're still working on lunches. We have the lunches that are separated out. Give you an example, Skyline Elementary. We know that we can distance 96 kids at one time for one lunch. There's 420 at Skyline, so that gives you an idea that we're looking at 4.5 lunches there, trying to figure out how to get all the students in there and give them lunch. So we're working on those kind of activities. Probably the hardest one is when we go home with parent car rider line and bus lines. So we're working on those things. I do want to say that we'll have excessive amount of hand washing and disinfecting practices throughout the day, in and outside the bathroom, outside of the room themselves and the bathrooms. So we'll be working on that for sanitation. We'll have plenty of hand sanitizer, wipes. We've ordered an enormous amount. Back to Vince's point, I thought that was really good. Just unbelievable amount of expenses that we're spending on materials. But this is for our kids, and we're good with that. So just want to confirm with you that we have huge amounts of PPE and sanitizing equipment in order and en route. And I've been told today that it should be here the 1st of August. Okay. The other thing, again, back to recess, we'll have them in quadrants and contacts. I won't talk about that anymore. May I have the next slide, please? And again, we're trying to distance students in all areas, but I want to be honest and transparent. And I'm going to be communicating to the staff. We can't guarantee that there's 6 feet between every child all the time for all day. We are trying to meet that less than 15 minutes of cumulative time in any one situation. We're working hard on that. And we'll be using those cohort systems to make sure that we can minimize the number that might be at risk. So that's where we are on that. May I have the next slide, please? Okay, so this is where I'm going to ask for some grace and help. Here's what I want to say is it is dangerous. So the virus is very dangerous. We respect it. Let's put it this way. I'll just say that we respect the virus because it can do a lot of damage to a healthy body, and it can also kill you. So that's not something to take lightly. But at the same time, I want to say that Harrison Schools is safe. I want to say that either way you choose as a parent to choose on-site or off-site learning, it's your choice. We're going to support you, and we're going to challenge your child with a good learning environment and move them forward so that they'll be a productive citizen when they graduate, and they'll have a good foundation that, like our Harrison kids have always done when we go out into the world and represent us well. So we're going to keep moving forward. Next slide, please. And the last one is, again, we're respectful of it, and our area educators are killing themselves. I don't know if Mr. Cantrell's on the line or not. We'll find out here in a second, but Jeff Cantrell is our OUR cooperative director, and we've been meeting quite a bit. I mean, they are on it. Our 16 schools are on it. We have safe schools. We have schools that are working very hard for parents and students. We've got this. I want you to help me put out an air of confidence that the school is going to be safe. It's going to be good. We're going to be protective. If it's time to shut it down and go home to be safe, we'll do that. If it's good enough to keep education on site, we're going to do that too. So I need you to help me put the word out that we have great schools in our area and great schools here in Harrison, and that we're going to take care of your kids either way. That's all I have, Bob.
Hey, Stuart, thank you very much. I think your last point that you made, and I think you emphasized it correctly, I would simply foot stomp again. It is important that we create that image. I don't think Jeff's on the call. At least I did not see him join. So, and we'll make a point of having him do that to be sure and be on the call to give us that perspective from the other big county schools here next time. But this has to be a widespread emphasis that it's the right thing to do to go to school. It's an economic issue, as you know, with parents. It's an economic issue with employers. So we need to make this work, and we'll support you in any way that we can. Thank you very much. Questions for Stuart, other than personal about your specific children?
I had a quick question. Dr. Pratt, do you have any indication of what percentage you think will go for that online training? Is there any, I mean, are you starting to see that yet?
We are. We gave a survey to our parents, and 85% of them are saying they're coming to school. They want their kids in school on site. And right now we have almost 200 parents signed up for off-site instruction that we're going to be providing. And if I can, I'm going to bird walk a little bit more. We have really resisted pre-K through second grade off-site, and I'll explain why. I think you guys are great parents, and I want to say that to everybody in Boone County and Newton County. We got great parents. However, no offense, you can't teach reading as well as we can. And at kindergarten, preschool, first grade, and second grade, those are the foundational years of teaching reading. And we have resisted having offsite instruction for those years. However, there's just been a surge of parents lately that's saying, well, if you're not going to offer it, we're just going to homeschool because my other two kids are going to be at home and I'm not going to send my kindergartner to school or my first grader. So we're yielding to that. I don't like it, just being honest. I don't think it's right. I don't think it's good for kids. I think if you want great foundational reading skills, which is the anchor pin, the linchpin, if you would, for all learning, you need to be at school, but we're going to offer off-site kindergarten, first and second grade, which is not on our website. It's not been promoted yet, but I'll be saying that at the end of this week in a video that goes out to all of our parents. But yeah, we have almost 200 people signed up for offsite right now.
Thank you.
Okay, Stuart, that's great. And Donna Bramer is sitting more than 6 feet away here at the chamber. And I'm looking at her to have her make that the headline for her report. Go to school this fall.
Go to school. And we'll keep you safe. And if it's bad, we'll go home. And if it's not bad, then we're going to keep learning forward either way.
It's good. All right, let me jump to Jeff is not on the call, as I said. Most of the schools are opening no later than the 26th, as Stuart mentioned. All right, Bill Knight, nonprofit groups.
Thank you. Sorry I was late getting here. Just to let you know, I made a presentation to the United Way last week, and I had mentioned that it seems like that even though with everything that's going on, that our count was kind of down as far as number of people we were serving. They made the comment that they had heard that from other nonprofits, that just things are kind of slow or slowing down a little bit with regard to the homeless. I know the sharing kitchen is closed this week and next week, and our numbers at House of Hope did go up, but nothing like we saw, say, 6 months ago. So, not really sure what's causing that. I don't know if the homeless are simply staying away, if they found other resources, if they went to other cities. Just really don't know right now. But in any event, we're still moving forward. We still have processes in place down there to take care of people. Two things that I mentioned before was that we applied for Emergency Solutions Grant, and we did learn last week that as far as the regular grant, which is a typical yearly year, that we have been approved for that. We just haven't heard how much we're going to get. We're told that 40 of 42 applicants will receive the money. The applicants actually are asked for $3.3 million. They only have about 2.1 to give out, and so clearly we won't get what we asked for. There's also a second grant called the Emergency Solutions Grant COVID. It's called CV for COVID, and there's been 35 applicants for that grant. That was a non-matching grant, which was pretty cool. We and I know Harrison Housing Authority and Ozark Opportunities are three of the locals that I know have applied for that grant. We are waiting to hear yet on who will receive it, and my presumption is we will hear once Little Rock has determined how they're going to distribute the ESG funds from the regular grant. Then they'll probably start working on that grant to figure out who will get it and how much they'll get. Both those grants become effective on October 1st. So that's it in a nutshell.
Good. Thank you very much, Bill. Any questions for Bill or the nonprofit community that he might answer?
This is Shonda. I just need to chime in. I forgot to send Bill this information. Apologize. Their numbers have dropped in regards to the clients that they've seen, but our numbers in housing have gone up drastically. The number of applicants in progress and applications, those that have been qualified and on the wait list, is the longest it's been since I've been there in about 5.5 years. So there's a huge need for people that need rental assistance. And the number of people, I don't know where they're staying or where they're going, but we are trying to track the homeless diligently. And we have a vast number of people that are homeless, but aren't going to Sharing Care or House of Hope for some reason. And we've asked them and directed them, just so you all know that housing assistance is more of a need than ever. And our numbers are the highest, our expenses are the highest, and our contribution per household is the highest it's ever been.
Shonda, what does that mean in actual numbers for Harrison and Boone County?
It means that I'm not sure which number you want me to give you, but basically, if you look at average contribution per household, we were at about 268 to 272 a household, and now we're up to over $300, and we're serving about 486 families right now. And because the costs have gone up so much, and we are staying consistent, even though, long story short, we should actually be helping more people, but because of COVID, we can't. We've applied for funds from HUD. There's a $100 million pot through the CARES Act to help us get through the year, because if we don't get those funds, we are going to have to drop about 8.9% of the families we serve right now. So I'm going to have to call them and say, sorry, we will no longer be able to provide rental assistance for you.
Okay, thank you. I think that that 400 plus number is the one I was looking for. It's a large number in our community. We all need to be sensitive to it, especially now. Okay, any questions for Bill or Shonda? All right, let's go to our tourism subgroup. Matt Bell.
Yes, so we had a meeting today. A few things. The Upper River, of course, they're essentially working on their annual budget consists of only 4 weeks of income, unfortunately. Now the Middle River, I spoke with Ben Milburn, Buffalo River Outfitters, and he's actually got a chance to be on par with 2019. He needs two things to happen. One, he needs rain. So rain needs to go south of Boone County, not to my lake up north. It needs to stay down in Newton County. And then the second thing is if the governor would extend that summer break just a little bit longer for the students, he could realistically meet or be on par with his 2019 sales. So that was kind of a shocker, but he said the phones are ringing off the hook and he's doing great. Restaurants, food costs are starting to level out, as well as the supply of food, items that they purchase that, were after the threat of factories shutting down, food processors shutting down, that seemed to go away for a little bit as long as it stays out of the media spotlight. And then lodging, right now our cabin rentals are holding strong. Of course, people are keeping those. Not a surprise, especially with the big outdoor travel push that's going on, and the staycationing associated with that. And then also our lodging partners inside the city limits of Harrison, the hotels are starting to see an uptick in motorcycle and family traffic. That family traffic being those that would have typically maybe gone to Florida or something like that, a big trip. Now they're staying a little bit closer to home and doing something outdoors. Allison Black with the fairgrounds has reported that rebuilding has begun after the fire, and she is submitting next week an ADH event application with the health department for a modified fare. So she hopes to have that fare still. And then Judy Mack is on here, reported that load factor was up to 49% versus over 80% in 2019. So still not where we want to be, but certainly up from the single digit load factor that we were at earlier in the year once COVID hit. And then a couple of things here at our office, hotels for the month of May, sales were down 62%. Which we'll take it. It's a lot better than the previous forecast at 80 to 90%. And then our restaurant sales were only down 8% within the city limits of Harrison for the month of May. So even prior to, the phase 2, we were still seeing some better numbers. And then Meeting convention sales, those are industry wide. Those are the biggest thing that's hurting right now. Companies aren't wanting to send their employees out of town. Obviously, you all are aware of that. You're just not traveling right now. It doesn't make sense. It's not worth the risk of them going out. And typically, your meetings and conventions are in a larger city, more populated areas. And so, why would you send Matt Bell down to Little Rock when he can just do some Zoom meetings? Another thing I determined today that there is such thing as Zoom, or in this case, Google Hangouts or Google Meet fatigue. That's a real thing. It's setting in. And two statistics I'll leave you with. Connect Travel said that 67% of travelers are actively booking their reservations based on cities or DMOs that are marketing masks. So by us having that mask campaign out there, it's actually favorable for those visitors to come. And then U.S. Travel Association said 8 out of 10 travelers believe that masks should be worn all the time in public. So 80% of travelers are saying that. So while we have a lot of knuckleheads out there that don't want to wear a mask, for the travel industry, it's very important and vital. I'll entertain any questions.
Thanks, Matt. Questions for Matt? Okay. Allison is on the call, and Judy, you're on the call as well. Do you have anything to supplement about the fairground or the airport?
I don't have anything, Bob.
Thanks, Judy.
I don't have anything else to report about the fair either.
Okay, Allison, we hope that your application to the Department of Health comes back in flying colors and soon.
Yes, I hope so too. It definitely will be different than anything we've done so far, but we're hopeful that we get approved and can continue.
Good. Okay, Gwen Hoffman for the finance subgroup.
Hello, everybody. Just a few little points of what's going on. Before, I think we've talked about the Main Street Lending Program. I don't believe anyone in town is participating in that program. Not that it can't happen, but they have changed those requirements and such since June. So those have been changed a little bit to make it easier for those folks to apply. Housing starts surged in June. Housing starts rose 17.3%, which is good. That's still down 4% from last year, but we will take that increase. Retail sales posts strong, and they continue to rise through June. Sales are up 7.5% from the month prior. And it says here that they were up 1.1% from a year ago. Home builders' confidence in the market for single-family homes surged 14 points to 72 in July, which is a good increase there. The 30-year mortgage rate dropped below 3%. This is for the first time in nearly 50 years in Freddie Mac's mortgage rate survey, landing at 2.98% this week. The 15-year was at 2.48. And then also, they continue to warn about fraud during this COVID time. Right now, the latest one is over Twitter accounts and fraudulent accounts, compromising accounts of public figures, organizations, and financial institutions. And so just pay attention to those items for your business and personally. And that's all I have at the moment.
Okay, thanks, Gwen. Any questions for Gwen about some of this information? The housing information is good. The retail sales information is good. Infrastructure subgroup. Jim, are you on?
Yes, star 6.
Jim Blackwell, are you on? Okay, let me tell you, we got Mark Martin is not available this afternoon, but he sent a new note that Energy has started a 12-month delayed payment agreement with customers. Apparently individuals, the company is reaching out to them since this is being prolonged, this crisis is being prolonged. Dottie, any update from Windstream?
No, just business as usual, case by case.
Okay, good, thank you. Okay, from the government, Daniel Bolin, are you on? Judge Hathaway is recovering from surgery. Keep him in your thoughts. Daniel's not on. Terry Crow, you called and said you wouldn't be on, but you are.
Yes, I did make it, but no real updates from the Valley Springs area.
Okay, thank you, sir. Mayor Jackson.
Yeah, Bob, I want to relinquish most of my time to Chris and Tim. I think they've got some exciting news, but two things I want to mention. I went out and I visited all the grocery stores, Walmart twice, Neighbors Mill. Almost everybody is at about 100%, 98 to 100% on mask. I was hoping for 80%. I mean, we are blowing by that right now. So I think this is so positive. The other thing that's a little different, Gwen mentioned interest rates. As you all know, we're going to be building a public safety building, and we have a bond that we're going to be pulling the trigger on any day. And we were quoted yesterday 1.9%. So we are really building at the right time. So
that's great.
Yeah, that's all I got.
Okay, Chris, you're on.
Yes, sir. Can you hear me, Bob?
Yes. Yes, sir.
Go, Chris.
All right. Can you hear me?
Yes.
Yes, sir.
Okay. We had Back Our Blue rally Friday night that most of y'all are aware of. That was, we were shocked. We really were. We were very humbled by that. Many of you may know this. Ben and Corley, I'm probably messing their name up, Forga, or I believe, they helped organize that along with many of the businesses here in town and our community. And they raised $45,000 that we split between our local troopers, sheriff's department, and city police. And we're speechless. We don't know what to say, but thank you, thank you, thank you. We're very fortunate to work in an area where we don't have problems. You know, when parents, their kids are in trouble, you know, they encourage them to go to the police. We're here to help. That's what we're here to do. And you know, we live in a fortunate area. We have good officers. Tim and I ensure that's the case. And thank you, thank the businesses, thank the community. I don't know what else to say. It was just truly, we were very humbled by that. Gwen touched on something a while ago that's been happening a lot. These people that's filing for unemployment benefits on people that's actually working. Whenever someone does that, they live in the county, call the sheriff's office. If they live in the city, call us. Basically, we'll do a call sheet on it, but then they report that to the Attorney General's office. And I spoke with folks in Attorney General Rutledge's office about that, and they're the ones that's handling that. But they want the initial report coming from their home jurisdiction. So with that in mind, if anybody has any questions, like the mayor said a while ago, we had a lot of people concerned about the mask, the state mandate. Tim and I worked on that Sunday afternoon. Well, just about all Sunday afternoon, and we thought we'd come up with something that would hopefully be very plain and very understanding. And bottom line is, this thing was going into two different camps. That's not what we're about. We're about bringing people together and compromise, and basically let's all do the right thing. And I think that's the message. That's the message we strive to put out, and hopefully that worked. We've not had a lot of calls on it. Very few. I don't know if we've had more than 2 or 3 since this came about on Monday. So everything went very well there. If you don't have any other questions for me, Tim, are you there on the line?
Yeah, I'm here.
Okay, go ahead.
I just want to echo what Chris has said about this community that we live in. Friday night, I was speechless. The number of people there, the amount of money that they raised for us, that's just unreal. The unemployment benefits thing, the only thing I would say about that, we are getting a lot of those here at the sheriff's office too. And that's kind of a big thing across our state right now. I've had people tell me that it's a little bit difficult to get through to the AG's office because there is so many calls. But just we do an initial report for the AG's office here. If you live in the county, get with us. We'll do that. Call the AG's office, and it may take you a few tries to get through, but they will answer your call. The mask thing. You know, I'll tell you this. All of my guys today got nice new black mask with a pretty gray badge on it. We've asked our people to wear those anytime they're out in public, can't social distance. If there's a question, put them on, and we continue to encourage everyone to do that. I actually went on the radio yesterday. I think, I don't think it's about writing tickets. It's about people getting their mask on and doing what we have to do to get rid of this. I really don't have anything else. If y'all have questions, I'd try to answer.
Hey, Tim and Chris, both from the chamber's perspective, the direction or your written description of how to handle the mask order was remarkable. It's been well received. I've passed it around to several other chambers. I have notes from other chambers that said, hey, this is great. We're sharing it with our police department instead of all the negative stuff that's going on. You guys did a great job, and certainly we would echo the Back Our Blue program on Friday. You did a great job. Any questions, though, for Tim or Chris from the team here? Before Joe Willis, who has joined, wraps up, I want to make two points. One, the $600 CARES Act unemployment stimulus ends July the 31st. I think we're going to see a major impact. I think folks in our industry will see the impact. I think folks in our food service, restaurant industry will see an impact. But it ends July 31st. And that's going to be important. It wouldn't surprise me if we see a lot of applications being turned in the next couple of weeks. The second is, and it's such a pleasure to be able to say this, Pace is now hiring for a company that went through bankruptcy, COVID-19 shutdown on customer impact. They are now hiring. They have 30 vacant positions available in Harrison. We also have other small businesses, Curtis Heating and Cooling, Strand. They've all got need for employees. So this is wonderful news for us to be able to come back in this still COVID-19 pandemic and know that we've got opportunity for hiring. So, pass that word. Keep that in mind. This is all positive for what we're doing. Joe Willis, over to you, sir.
Bob, thank you. And I want to say thanks to all of you who are still with us, and even I guess for those who have dropped off, at least for their participation up to this point. Apologize for being as late as I was joining you. I got hung up, but I didn't get a chance to hear the healthcare update piece of it. And I know just from what we've been seeing with the governor's report that things are not necessarily great, although today's information seemed to be heading a little bit better in the direction, and that's favorable. Given that, I would like to ask for those who are still on there, do you think we need to be meeting more frequently than we are? We went from a weekly to a bi-weekly. Is there a sense of urgency from anyone, or is there any thought from the group or individuals as to whether we should make this more frequent? Okay. Hearing none, I would assume then that bi-weekly is still sufficient. Bob, do you have any thoughts from you and Melissa there?
I think we're good with bi-weekly at this point. If this changes, let me ask if there's serious input from the health community, Vince, Sammy. We need to jump on something, let us know, and we can pull a meeting together very quickly.
Okay, sounds great. I have nothing further, Bob, if you need to wrap up with anything. Thank you guys again.
That's good. Thanks very much for everybody joining today. We appreciate it. Great communication, great collaboration. Thanks, and you all stay safe.